A male patient, and he's 31 years old, and he was diagnosed with ulcerative colitis 3 years ago. And it's important to know his history because many of you out there are probably suffering from the same things if all you've had is conventional medical treatment. Now, this patient had tried 4 biologic medications: Humira, Entyvio, Rinvoq, and Tremfya. He reports that none of those 4 created significant benefit for him. When he presented to me, he was on Rinvoq and Tremfya still, and he was on prednisone as a steroid taper for an acute flare. When he first came in, he was finishing that up. He presented on Rinvoq and prednisone, and both of those medications have the possible side effects of GI perforation, which is a hole in your colon or in your GI tract somewhere. We don't want that when you have ever, right? But when you have ulcerative colitis, you're already dealing with ulcers or kind of half holes in your GI tract. So we don't want to create more holes. Rinvoq also brings along with it the risk of cancer and viral infections. Tremfya, before we go there, prednisone also brings with it the risk of low potassium, which will be important here in a moment. Tremfya brings with it the risk of infection, diarrhea, which if you're familiar with ulcerative colitis, diarrhea is already pretty frequent, and gastroenteritis is a risk of Tremfya. Regardless of whether you have ulcerative colitis or not, for whatever reason you may be taking Tremfya, gastroenteritis is a potential adverse event. Well, gastroenteritis is inflammation of the GI tract, which we're trying to fight.